Hello, and thank you for joining us on another episode of Rise and Thrive with EHE Health, an interactive series where we discuss all things health together. My name is Veronica Munoz, and I'm a National Account Manager here at EHE. And today I am joined by Dr. Sean Coleman, PT, DPT, CSES. Welcome so much, Dr. Sean. I'll go ahead and give you a couple of minutes to introduce yourself.
Yeah, thank you. Thanks for having me. My name is Dr. Sean Coleman. I'm a physical therapist and strength and conditioning coach. Originally from Philadelphia. I just moved to California not too long ago, but most of my career has been spent in sports orthopedics. So that's kind of where my passion is. And since moving out to California, I've kind of started a little bit of a social media following and Instagram page, and just trying to find best ways to reach as many people as I can while still working in the clinic.
No, awesome. That's awesome. So it's great that you're building a social media following as well. As you know, EHE does a lot of social media as well, and we're going to be sharing this later. So it'll be another great way to get all the information out there. And today we are going to be covering the topic of pain and chronic pain. So we know pain is the body's way of saying something that is wrong. It could be short-term or long-term pain, or it could be pain that is due to a sudden or specific event, or pain that slowly develops over a period of time due to a medical condition. So we know it affects at least 50 million Americans, and we know nearly 20 million of these individuals live with high impact pain or pain that is significantly impacts their daily life. So Dr. Sean, can you explain what acute and chronic pain is and what the difference is?
Yeah, so first, acute pain would be your body's response to a sudden traumatic event. So it's the initial response. So pain, edema or swelling, redness, tenderness, those are kind of acute responses to a trauma. You bend over and you feel a tweak in your back. Your body goes into a sequelae of reactions to help yourself get over that initial injury as quickly as possible. So bruising from getting hit by something, swelling from rolling your ankle, those are all kind of acute responses to pain. Chronic pain is a little different, and it's a little bit more complicated, and especially the more we're learning about it, the more complicated it's getting. But when you're dealing with chronic pain, it's usually a mixed signal into your brain from overuse. It could be poor healing from that acute trauma. So you get this acute injury that kind of lingers and becomes chronic. Or like I've said before, kind of wear and tear, poor body mechanics. These things kind of are almost like a slow play of pain. So when you're dealing with chronic pain, it's a little bit tougher to treat and to deal with, because you kind of have to start putting pieces to a puzzle together, versus acute pain, which is, we know the mechanism, it just occurred. It's a little bit different in their treatments.
Okay, awesome. Thank you. That's super informative. And we know that, of course, there are preventative steps that can be taken, like getting proper medical treatment for the cause of acute pain, and adhering to treatment plans. Anything revolving like good sleep and good health, I know, is always going to help as well. Managing stress. Aside from this, can you discuss some ways to prevent chronic pain from interfering with day-to-day priorities?
Yeah, I mean, we always say movement is medicine, right? So we're kind of in this new kind of age of we're getting away from the rest and recovery style of dealing with pain and injury. Early intervention and early mobility has been shown to be very, very effective in dealing with acute injuries. So as long as you're taking the proper steps and you're getting a proper evaluation from a medical professional to know you're okay to move, the movement is the best thing you can do. So typically it's just kind of gentle mobility, active range of motion, not cranking through areas of discomfort. But those are really good ways to help promote the healing process. And that's kind of our goal with acute injuries.
Got it. Thank you. And moving aside from more movement and more into like mental, I know a lot of people are taking now a closer look at their mental health. And a question that we've seen coming up is any type of help knowing if anxiety and depression affects pain, either acute pain or chronic pain.
Yeah, most definitely. It's a huge part of the recovery. You know, we can always, it's very easy for people to assume that stress can cause neck pain. You know, that's a lot of people come in with neck pain and that's what they say. I know it's coming from my stress and my everyday activities. Well, the same thing can be said for a positive outlook, and managing your stresses can So it can help unload some of those the burdens of hypertonicity and the issues that come from high levels of stress. So we know the psychosomatic component of pain and negative thoughts, and trying to promote more kind of positive, optimistic outlooks on your pain is probably the first thing I do when I have a patient come into the clinic. Start talking about what you can do, what you are able to do, what it's not limiting you in doing, can be huge in the initial steps forward, and having that pain start to allow more movement.
Awesome, great. Any other, I guess, like quick tips or anything that you can provide our audience if they're experiencing any type of pain now, of course, aside from going in and talking to their doctor about it?
Yeah, I think depending on the injury and the trauma, a lot of it is kind of like I said that before, the active movement, staying positive. You have all these outlets in front of you, EHE and myself. There are avenues you can go to seek medical treatment. So don't be in fear of reaching out to people and getting good information. But as far as just managing it acutely, we're getting away from the hammering anti-inflammatories. They're shown to kind of not necessarily promote as much of a healing process as we'd like them to. Usually for an acute trauma, a rolled ankle, something swollen, elevation, compression are probably the biggest things you can do. I know we're big into the RICE method of RICE, or rest, ice, compression, elevation, but the last two, compression, elevation, have really been shown to be the more consistent ones. So I'd say if you're going to deal with an injury and you've got a trauma that you just experienced, don't know where to go, get it above your head, get it above your heart, wrap it up nice and firmly. Everything likes a little hug, so compression's always nice.
No, that's super helpful, especially if something comes up where you're out and about, you're being active, riding a bike, and something happens and you need to just have it feel better quickly. I think that's a really good tip. So thank you.
Yeah.
All right, well, great. Thank you again. I want to add that EHE Health promotes adequate behaviors that can help return pain, and we focus on encourage healthy lifestyles with sufficient daily movement to improve overall general health. Dr. Sean, thank you again for joining us today, and go ahead and let us know where to find you.
Yeah, you can find me. I recently just relocated to, I'm wearing the t-shirt, Thrive Physical Therapy, Rise and Thrive, right? Thrive Physical Therapy in downtown San Diego, in the Bankers Hill section. So just starting there. So it's a cash-based clinic. So it really gives us the freedom to really treat people's injuries and chronic issues the way that we really can in this industry. And you can also find me on my social media page, Coleman PT_performance, and my YouTube channel, Coleman PT_performance.
Great. Thank you so much. Be sure to tune into next week's episode of Rise and Thrive, everyone, with EHE. And thank you again, Dr. Sean, for joining us.
Yeah, of course. Thank you for having me.